Thank you so much. Good evening or good afternoon, Chair and committee members. It is my privilege to be here. I am Assemblywoman Heidi Kasama from District 2, and I am here with my colleague, my senator colleague here, Orenshaw, to present Assembly Bill 188, a critical expansion of the current right to try law. This bill seeks to address the pressing issue faced by patients diagnosed with life-threatening diseases or conditions who have exhausted all approved treatment options and cannot participate in clinical trials. The Right to Try Act, both at the federal and state level, has long provided these patients with the opportunity to access investigational treatments. However, it is now time to evolve and adapt the law to the changing landscape of medical innovation. As we stand here today, advances in medical technology have led to the development of personalized treatments based on an individual's genetic information. These treatments are becoming increasingly vital for patients with rare and ultra-rare diseases who have been left with no other options. Unfortunately, the current FDA regulations are not well suited to handle these cutting-edge personalized treatments, often acting as a barrier to life-saving medications that patients desperately need. It is our responsibility to address these shortcomings and create a more flexible and patient-centric regulatory framework. Assembly Bill 188 represents a significant step in the right direction. By building upon the success of existing right-to-try laws, this bill aims to foster an environment that gives access to the latest cutting-edge technologies, enabling patients to access therapies specially tailored to their genetics. Across the country, patients facing terminal illness have been able to access treatments that have undergone basic FDA safety evaluation, but have not yet been fully approved, all thanks to the right to try laws. These laws have approved and saved the lives of individuals suffering from illnesses such as cancer, ALS, and now COVID-19. Medical innovation is rapidly outpacing regulations that were established decades ago for a very different era of medicine. The FDA's approval process was not designed with individual treatments in mind, and as such, it can take an unacceptable amount of time for these life-saving medications to reach patients. In conclusion, as lawmakers, we need to recognize and adapt to the ever-evolving landscape of medical treatments. By expanding the right to try law through Assembly Bill 188, we can ensure that patients in dire need have access to the most advanced, personalized treatments available without being hindered by outdated regulations. Let us put patients first, allowing them the right to try and fight for their lives.